Good morning. I'm Jane Thornhill, Vice President of Operations for Henry Ford Physician Network. I joined the HFPN team a little over a year ago to reignite and rebuild the HFPN. I'm the administrative partner to Dr. Bruce Muma, our network CEO. Today represents in many ways our success in creating a new vision. I have the privilege of representing the administrative HFPN team. They're extraordinary individuals committed to the success of the HFPN in doing meaningful work. Our rebuilding efforts were focused in a number of ways. We changed our governance structure to allow for equity among our membership. Our board and committees represent our membership. We demonstrate our decisioning as a composite of their members and their perspectives. It doesn't matter if you're employed by Henry Ford or if you're one of our hundreds of independent providers. You have a voice, and we hear you. We're focused on pursuing value-based contracts that can enhance the practices of our providers and the lives of the patients that we share in our community. We're fully engaged in providing our members with the services and assistance they desire to be as successful as possible. In this role, I have the chance to work alongside extraordinary administrators and providers that make up the HFPN. It's a privilege and a pleasure to partner with them together to bring value to the patients that we serve. Given the membership that's represented in our provider network and their locations throughout southeastern Michigan, the HFPN is well positioned to be a high-performing network. We intend to build on this foundation and to be the absolute most effective clinically integrated network possible. Thank you for joining us today.
Connecting with the HFPN over the past year has been extremely helpful for our organization. So Oakland Southfield Physicians is an independent physician organization. Through our relationship with Henry Ford Physician Network is at the benefit of the Henry Ford Health System supporting us. It's opened up access to innovative contracts and care delivery models that we otherwise may not be part of. In addition, it's brought the opportunity for new patients into our clinics and really bolstered the overall strength of the organization.
Working with the HFPN administrators has been really helpful. They've been very informative. Whenever I have questions or issues or concerns, they're always very responsive.
Working with the HFPN from an administrative basis or an operational perspective is unusual. It's very valuable for our organization and for others in that it offers a trusted community. It's a community where it's safe to push the envelope and to share new care delivery models, where you have an equal voice with a very diverse community. And I really feel that that diversity from an operational or administrative perspective, quite frankly, is the strength. And using that diversity to advance innovative care models, to advance health information exchange, to advance new contracting templates that aren't otherwise available, and being that contributor to the administrative group is what helps to activate our overall success.
Working with the HFPN administration really is a very good experience for all of us. They are very responsive to our issues or concerns that we have, but at the same time, they make suggestions that make a lot of sense for GMPN. And when we both decide on goals that we want to work with together, we're able to effectively obtain those goals through collaboration.
You know, it's such a great opportunity to have resources within the system that we can share with the other members of HFPN, especially during crisis times like COVID. If we're able to develop some tool, some resource, anything that we can offer, we're very happy to do so.
An example of how being connected with HFPN has helped the Greater Macomb Physician Network over the past year, first of all, is by having a great collaborative relationship with HFPN. HFPN has been very responsive to our questions and needs that we've had, especially because GMPN has a large portion of our docs who are employed by Henry Ford Macomb. And that has allowed us to look at the metrics and various goals, such as providing value for our patients, and align those goals with HFPN in very many cases.
Thinking back on how the HFPN has really helped Oakland Southfield physicians and our organization through the COVID-19 public health pandemic has been enlightening. I would sum it up in you truly are not in this alone. The pandemic brought to our community, our care community here in Southeast Michigan, a true sense of isolation, both structural and personal. Through the HFPN, we were now plugged into a community that was trying to do the same things we were doing. We learned of the journey within the Henry Ford Health System. We were able to gain access to experts, to hear about things like safety, to hear about how do you open clinics safely, what does care delivery look like, at the time what we thought would be the other side, but we're kind of still in it.
You know, we are so fortunate as a system to have the HFPN. I mean, how many systems have an employed medical group and have access and collaborative relationships with private practice groups like we do to this extent. So it is a thrill and an honor to be part of this group.
What would I like to see from the HFPN in the future? Henry Ford Physician Network sticking to its core, doing what it's currently doing today, and inviting us into the model, having everyone contribute equally. Much of the same, much of the foundation that has been laid, but continuing to strengthen that foundation. And it's my true belief that the Henry Ford Physician Network's future is going to elevate everyone involved.
You know, one of the challenges in our roles is that we easily become very insular and focus only on our own practice. One of the things that the HFPN does very well is it creates this safe sharing forum where we can all get together, we learn from each other, we can talk about how we interpret metrics, how we might change practice. It's really helpful to know what private practices are thinking about so that we can complement that work and work more collaboratively together.
So we think that telemedicine, as evidenced by COVID, is going to be something that most organizations will need some help with. And we look forward to working with HFPN on new technologies, finding out ways of getting vitals from patients, delivering care virtually to our patients, and using new technologies so that we can provide even better and more thorough care for those patients. In the future, what I look forward to seeing from the HFPN is a focus on telemedicine and a way that both GMPN and HFPN can provide more thorough services for our patients through telemedicine and using new modalities and technologies that become available to provide that service for them.
As a member of HFPN, we were able to take part and offered the purview of the Henry Ford System's vaccine trial. Truly nationwide, one of the few that were part of that initiative, and that felt like so much to our network, and it was one of the ways HFPN and the Henry Ford Health System has helped us to settle in to what is our new normal, and we look ahead to what the future may look like together.
I couldn't imagine being in a better position than I'm in now, serving a group of employed physicians who are so dedicated to patient care, and on top of that, they're so focused on their academic and research mission. It is the greatest role, it is the greatest opportunity I could ever imagine having.
Dr. Muma is doing a really great job and listening to the concerns of physicians like myself when it comes to working in a new and collaborative model with regards to networks.